I just want to say thank you so much for having me and for welcoming me to the I know just to be honest, I appreciate all the help and everybody being so nice and cooperative. Okay. As I'm learning, working the system. Thank you so much for introducing me here. Okay, and I'm going to pass this back to you.
Well, welcome. I don't know if many or any of you are here for our last meeting. We're planning extra meetings so we're getting action. So if you'd like to keep it time, please come back. I believe the topic was either vitamins pre and during pregnancy, but I think we can extend that to beyond pregnancy. So to start off, because I see she has papers with her, I will do Dr. Tran-Kim.
So pretty much we wanted to make the kind of more of a discussion type style. So one thing I wanted to do, pretty much my papers are just kind of quick notes, but frequently asked questions about vitamins. So one thing I want to say is the theme of my whole presentation is obviously are vitamins necessary for all women? And I want to say always be first, food first, supplementation second. Because a lot of the vitamins, although we need some vitamins, are going to eat from food. And healthy living lifestyle is like the main thing for me. And I definitely, when I see my patients, I tell them, healthy lifestyle, eating well, making sure you get enough in your diet is the most important thing to get all your vitamins. I'm sure I want to ask this question. DeNicola agrees with that. Supplementation.
I would say food.
So pretty much are vitamins necessary? Yes, but you don't have to get an actual vitamin. However, supplementation is something that you can always add. And definitely there's certain reasons why to add that. But also understanding that you hear a lot about large doses and things like that. Is that beneficial? And you have to understand how vitamins work. So they are water soluble vitamins, and there are vitamins that are fat soluble. Okay, and let me kind of differentiate. Fat soluble vitamins are vitamins that can be stored in the body. They're stored in fat, stored in the liver. So those vitamins you don't have to take as much of because your body will store that. Whereas the water soluble vitamins are the ones that you will need to replenish because your body will get rid of those through your diet. So those are the different kind of vitamins. So what vitamins are what? So one thing I remember from medical school, and a lot of you always hear is ADEK, A-D-E-K. Those are the fat soluble vitamins. So those are the vitamins that your body stores. So just remember that. So the rest, the B and C vitamins, so you hear about B complex vitamins and C vitamins, those are the vitamins that are soluble. So those are ones that are actually expelled through your urine. Okay. So fat soluble urine, so I talked about vitamin A, D, E, and K. So those are vitamins that you do need in your body. So what I want to emphasize is what type of food sources can you get these, vitamins from? So for example, you think about it as like dark leafy vegetables you can get that from. You can get it from certain liver sources, you get it from carrots. And the reason why I always remember this vitamin is when I was in med school, is that if you take this vitamin in large doses, you will become orange. So in my mind, I always remember this. It's consumer carrots, things that are like orange and color. So, and it's really interesting. Apparently, it's very high in vitamin A. So Eskimos actually get yellow skin on you. So I always remember this. So that's interesting. And this is a fat soluble. That's the reason why too much of it can be painful for you. Okay? Vitamin D, you hear about a lot. Vitamin D is what you actually would get from sunlight as well. But you also have food sources like this 40% of what you get. So that's something you can also get from that. You don't get to go outside. And my thing is, once again, go outside, exercise, get that vitamin D in your skin. It's very good for you. But that's something you can also supplement. Vitamin E, you can find it in vegetable fruits, vegetables as well. And they're also in fortified cereals. And vitamin K is in leafy vegetables. So you hear me, you're going to hear me say vegetables a lot because vitamins contain a lot of vitamins you can do. Anything on that? Okay. Just not if I'm recording the microphone too much. Okay. All right. So just a couple of resources for key facts on these vitamins. So now we're talking about the water soluble. So the B complex vitamins, which there are so many of them, I'm going to kind of name them, but overall we're going to talk about, and also vitamin C, which you always hear about. And there's a lot of controversy with vitamin C, so I'm going to mention kind of like beginning questions, okay? And if you have any questions, please raise your hand anytime. And obviously at the end, any questions you have, you can always come to me and answer the comments as well. So, like I said, vitamin D and vitamin C are not stored in the body. The way fat is, we need to replace it. High doses of this also is not recommended. A lot of times, if you take a lot of vitamin C, for example, it can cause like nausea, it can cause diarrhea as well in high doses. So, proper storage and preparation of this is very important for foods because it can be easily destroyed. Okay, so important refrigerate fruits and vegetables. Making sure that milk products and everything else you stay away from like refrigerator that's using a lot doesn't stay on long, just for your electricity, okay? And also keeping grains is not away from long as well. Because it will actually deplete the vitamins from those food sources. Okay? So B complex, there's a lot. There's thiamine, there's protein, there's folic acid, niacin, there's all this large range of nutrition for B vitamins. And pretty much with these vitamins, it's really important that you can find them in so many sources. So cereals are always cereal grains, fortified in them. You can find them in meats, you can find them in poultry, eggs, fish, milk, the beans, which are like beans products, all kinds. And you can also find them in fresh vegetables, like olive. Vitamin C, you always hear about citrus fruit, things like that. That's what you can find them in. So, one question I get asked a lot of patients is, does vitamin C prevent the cold? And I take a huge amount of it, and my cold will go away. So, recent studies, okay, have shown that even if you take a large amount of vitamin C, what they did was they tested patients after they took a large amount, how much was actually retained in the body, and it showed that overall the level of vitamin C did not increase even with these large low doses. So this is very controversial still, but there's no evidence-based medicine to actually back it up. Yes, okay, just checking in with you. Sure. So apart from that, there are other vitamins I always mention: calcium, medicines in milk products, tofu, broccoli, kale as well. It's also contained in most grains, potassium, bananas, you as well. Zinc is in animal products and beans and nuts. Iodine, which is something I want to mention, is usually in salt, iodine, salt, iodine, salt. The reason I want to mention all these as well is because the CDC every year does a bunch of studies, and one of the studies we did was the second nutrition study, and it showed that in the U.S., most population, that they studied in large cities, only 30% of the population actually had deficiency in different types of nutrients. And the most common nutrients are vitamin B6, vitamin D, and iron. So those, apart from all others, the numbers are actually quite low. And 10% is actually not that high. And obviously the numbers vary from ethnicity, gender, age, different sex, things like that. But those are the main ones. And it's not even that high of a number, which tells us that even though vitamins and everything, food is the main thing. And I was going to lower socioeconomic groups that didn't have enough food usually have the lowest, have the most deficiencies. And you can see it in the population. Okay, any questions out there right now? Yes. So, no, I agree. So, the main thing is a lot of you have it. Because even if, like, for example, cereals is one of those things that are so fortified. So, the reason why a lot of cereals are very popular compared to like sugar cereal and these type of grains are very fortified with or anything like that, that even vegetarian, if you were a vegetarian, for example, one of the things you worry about is B12. If B12 is actually full because of milk or egg. So every vitamin out there, usually pre-supplementation is sufficient. There are, there are certain things that you do recommend for, which I will have Dr. Doug go through the briefing with it, but there are some things that we do, so certain vitamins are good. But there's nothing, I would say, nothing wrong with supplementation. However, I would talk about it.
Rest of you can't, but not that. There was an interesting study many years ago, I think in the 60s or 70s, I think they were presenting a century because it's not unethical, but it's a boarding school, and they, I don't know if they're a month or two, jury rated the diet. So they were getting enough calories, they weren't just in the restaurant starving, but they purposely withheld certain vitamins and minerals from the diet for 7 months. Because the boarding school, all 3 was used in the cafeteria. Then they put out a normal buffet, 3 meals a day for Ob-Gyn. And these were kids under age 10, they really didn't have knowledge of what vitamins were and what food supplements were taught. And there was a huge correlation with the foods you selected at a buffet happened to match exactly what they were depriving for the last couple of months. Like if they held back on vitamin C, they instinctively went for sliced oranges or that kind of thing. If they purposely withheld calcium, they purposely went for foods high in calcium, even though they don't really think they're required. So, and that's actually been introduced in other studies, but not quite as serious as that. So I think it tells us that, to answer your question, Kathy, our bodies tell us what to eat. So if you ever find yourself craving something, and you think maybe you're craving it because you saw it on TV, maybe you're craving it because you're a little low in that vitamin that day, and maybe your body is craving it to replace the vitamin. So I think our bodies do a pretty good job of picking the right foods to match them.
Reminds me of I don't think it can, but I was just like, my body always craves chocolate. And but I will say that I do agree with Dr. Nicole on that. I think not only pregnancy that happens really often, a lot of women that have really bad emotional vomiting will crave a lot of the fortified drugs and things like that because they're very high in vitamins. And one of the treatments for, nausea and vomiting in pregnancy is B6. So that's really funny because it's anything like in studies, like actually I've read about this, and yeah, I actually fully agree. Food is your body will crave what you need. In pregnancy, I mean, how much more can you crave if feeling sick for the first, 14 weeks? And B vitamins will help with that. So, this slide is going to talk about a lot about pregnancy and prenatal vitamins. I'm just going to mention it briefly. So prenatal vitamins are different from other vitamins, just like women's vitamins. One of the things is folic acid. We recommend that during pregnancy, and definitely if you have any type of high risk pregnancy that happens and no tube defects, which is a indicators with vitamin spine that doesn't close during the development. And so that's something that you might talk to with your OB about increasing folic acid. That's something that's definitely prenatal vitamins. The other thing we talked a lot of pregnant women is increasing the iron density. The reason why is because with blood volume increases by 2%, with a lot of demand, with the placenta. So that's something also prenatal vitamins, and sometimes OBs will tell you to take a little more, especially if there's no defect, maybe something that you need just to cover that as well. Other things in there, DHA, and also the numbers are not the same. The daily value of prenatal vitamins are not the same as the daily value. For example, vitamin A, genetic level of fat, and pregnancy defect constant. Yes.
Thank you.
Okay. Aside from that, I did mention any breastfed babies, a lot of times what happens is when they're really little, and I actually come from New York City where we don't have sunshine all the time like California, so I don't think it's much of a problem here. But there, especially during the winter, the babies are completely bundled up. I mean, I'm talking about Thanksgiving gets really cold, especially during winter, and we don't have a lot of sun. So breast milk doesn't have vitamin D, so you usually get that from the sun or it's fortified in some way in milk, and there's no way to fortify breast milk, sadly. But that's one thing I do tell patients that if you do have a baby in menstrual cycle, you're not going to be able to add a lot to add vitamin D. So that's one thing I tell my pregnant moms that are exclusively breastfeeding that babies need. So one question I also get patients asking is, do vitamins prevent such and such? And one thing I've had a patient say, try to vitamins to prevent cancer. And there is no proof for that at all. No evidence-based studies have ever confirmed this. Same thing for heart disease or diabetes or anything like that. There is one thing that you'll hear maybe your physician thinking for osteoporosis, they might check for make sure you get calcium and vitamin D and things like that. But saying osteoporosis is just not one thing, just to get known, it goes away. It's big hair exercises. It has to do with like the estrogen, it has to do with the age, your gender, there's a women, genetics, as you see. And also genetics play a role with this too. So it's not just one thing. So it's something that needs to be treated. So just not, taking calcium. It's not the only mental health. There's exercise, things like that are very important. So one thing let's talk is large doses of medication, of vitamins specifically. So large doses or microdoses, sometimes you'll hear, they can cause health problems. I mean, usually they're mild, they might have some women, if it's a large fatigue, they can have diarrhea, abdominal pain, things like that. But there are some that can be dangerous. So if you decided taking that medication, raise the medication, just come in after the question. And if I don't know, we'll look it up because the CDC there gets a lot of information about it because there's things I'm not common. And I definitely I get a lot of patients coming in it's during the flu season I took a large dose of vitamin C and I've been having a lot of abdominal pain. Like, yeah, it's like ordinary, and you can have it is excreted, but your kidneys only work so fast. So taking those large doses a lot of times can be harmful as well. So
Any questions? Dr. Tran-Kim? For the people on TV, people in the back row, Jess said that she always finds vitamin B to be very helpful for her, but a certain type of protein levels her to have a low appetite. So, I will let Dr. Tran-Kim comment on that since I have
So depending what that protein is, I mean, because I'm not really sure how it's affecting your metabolism, it would depend on the composition. But I'm trying to think. Vitamin D, usually depending on what type, can help with a lot of like energy, metabolism. It can also help with like cell regeneration. So things that can help to help health. So that's why vitamin D is very important. And I'm wondering if that's the reason why it's, increasing all this for you. Or you also hear about all the vitamin B12 shot, and feel like a boost of energy. And vitamin D is kind of the reason why is because, yes, they're involved with energy and everything. So that's probably the reason why you're getting that boost. Yes. Mm-hmm. And yes. Mm-hmm. Mm-hmm. It's a mouse. Mm-hmm. Mm-hmm.
just to be devil's advocate, I will ask our audience and people on TV play along too, from home. What kind of evidence is there to check? Let's start with female. Like, what kind of vitamins or minerals should women take? What kind of evidence is there? Calcium, very popular these days. You mentioned D3, so vitamin B. Well, that's more like as a doctor, what should I be checking? Should I be checking calcium levels and vitamin D in my teeth? Yeah, many institutions have spent millions and millions of dollars studying this. And there is no evidence for doctors to check any kind of levels. So there's no reason to check the vitamin D level or calcium. I suspect that the Tran-Kim does check vitamin D levels. I went for my physical this year, and my doctor wanted to check my vitamin D level. There's evidence for this, and no evidence to check my vitamin D level. If you're my patient, I doubt you've had your vitamin D checked. Yeah, if you ask for it, I'll do it. But there's really no evidence to check for that. Which I think I'm under to be wrong for that. But, well, no, yes, they do, but sometimes, I didn't say there's never going to be evidence. I'm saying that with all the studies out there, they studied it, and there's something called the United States Caduceus Task Force, that's by the government. It spends hours and hours and hours researching data, notifying companies, everything to get straight in there. And they do what they call an I recommendation. I means insufficient evidence to recommend. They didn't give it a B level, B means don't check it. So, but they couldn't give it an A or B recommendation, which is strong evidence to do it. So I don't believe my colleagues on this campus who do check vitamin D, I think that everybody are wrong. I just don't think the evidence to do it. There's no evidence to check for it, and in fact, when they studied it, they found no evidence to take vitamin D. So you certainly can take it for it, I think you're taking calcium. But now if you're treating a condition like osteoporosis, that's different. We're talking about screening the general population and taking the medicine, taking the calcium. Yeah. How about other vitamins like vitamin D? Anybody have any vitamin D? Like vitamin D for little kids or heart or something? And beta carotene, how about beta carotene? Beta carotene and vitamin D are advised by not only the task force but my own society that is working cancer practice not to take. Do not take vitamin D. Do not take protein. It's related to thyroid cancer. So I came to tell you not to take some. There is one actually indication to take, to check for doctors to check and for patients to take vitamin D because you really want to guess what that is? It's not a sentence. If it's determined by the physician that the patient, because of their senior service status or other status, are at a high risk for fall, there is a good outcome, maybe the good recommendation, put out some data to check vitamin D and check calcium and to take vitamin D with it. Yes. So if you felt you were a loved one who were at a high risk for a fall, totally a walker, and sitting in the baby. But I realize this isn't a popular thing to say publicly, but really there is no evidence to take any vitamin at all. And the odds are it's vitamin D makes people feel perky, it's much better. But I still read and try to find data one of these days, maybe we'll have some kind of data that shows it's sensitive. So far, there's very little data out there. You want to comment or question? Imagine that. Yeah, looks like there was a shoe store there. I should have been buy a pair of shoes. I don't quite get how that happened. That's what I make it. The pendulum has swung on that a lot. I was very neutral on it for a long time, and the evidence was really, really good. But this is for heart disease and cholesterol and plaque and that. I don't think it was. I read about Alzheimer's prevention, so I think it's up there. Now I believe the studies have kind of figured out where they're not very helpful. I believe some organizations, like the cardiac organization, are no longer recommending it. And they found that the high doses are harmful. So I don't know. I love fish and I eat a lot of salmon, and so I'm here getting my omega-3s food. I do recommend my patients with high cholesterol if they can't take pivotal, if they're muscle aches or something else. But that's a case where it depends what year you're asking. 5 years ago, I would have said there's a lot of good data. Now, less so. You take it? I don't think any of it is bad for us. The vitamins, yeah. As far as a bottle of multivitamins, like everybody has back in the room, we sell here in a store, typical everyday multivitamin is not harmful. That wasn't my point. My point was more it's probably not good. But now we're talking about it, I do think that Dr. Tran-Kim pointed one out, but I think a number of things that people probably should take vitamins. There's not a few, yes, that's a good one. That works for that. Very good. You're correct. 100% correct. How about people who might be bulimic or abusive? Unfortunately, I thought that if somebody had an eating disorder, well, the kind of eating disorder you don't eat, not the one that too much of the one where you don't. Yes. They have dumping syndrome from that. So, yeah, if you have some, because that's not the general population. Have a tendency to throw up a lot after your meals or just skip 2 days. It's probably beneficial to take some multivitamins. I think that's been shown. There are patients who are people who are lacto, ovo, something, vegetarians who only flaxseed and meal. I don't know. Either it's religious or health reasons or whatever, and they might do well as Dr. Tran-Kim said with B12 and a few other vitamins or things like venison and yes.
So, I think that I surgery, my client's arthritis, which was corrected. So, we recommend
I will take that next step, Dr. Tran-Kim. I used to a lot until I took it and didn't do anything. But it makes sense. The first was used in horses, racehorses, to prevent the arthritis they get when they track, and it worked great in that. My patients are about 50-50, about half swear by it and half are like me and say, because it's safe and it's not all that expensive, you sell them in their store. I tell my patients to try it sometimes, but I haven't been able to do it. Getting back to things you might want to take vitamins if you're not the general public, if you enjoy your wine, beer, and martinis to the point of having 6 or 15 or more a day. I'm saying if you're an alcoholic. The B12, folic acid are sometimes given that particular case. If you have the disease called pernicious anemia, you might take vitamin B12, and Michelle mentioned if you're anemic in general, you might take iron. That's not a vitamin per se, but take iron for that. And as Dr. Tran-Kim pointed out, morning sickness of pregnancy, it's kind of anecdotal. I think the studies are pretty supportive of taking vitamin B6 and usually look at the and to others in case I analyze Dr. Tran-Kim to think of other conditions you might be thinking about.
So, also with alcoholism planning as well. Something that we recommend. So that's more in your mind, but we pick most of them.
Should that be there?
Yeah, there's really not that many. I mean, obviously, any type of mild brain condition, the gut, I mean, you mentioned it, that it's just moving it as well. What's interesting with that is sometimes it can be masked by taking too much folic acid. So that's one thing that your doctor has any, information like doubts or, your symptoms, then they do, that's one of the times they would check your B12 to see if it is low. And, if it's a sex finishes anemia, but that's not something that's common in the general population either. I mean, obviously during pregnancy, we do check, make sure you're not anemic, so that's a kind of so important. And you want to make sure, because obviously if you do have that delivery or C-section, you want to make sure that, the numbers are stable and normal, so that's why the doctors do CBC to check for anemia and things like that. And I can also osteoporosis as well. That's another thing that's standing heavy. I guess I just want to mention again, remembering ADEK are the ones that are sorting it out. So taking high dose of that can be harmful for the treats that liver problems, kidney problems, things that cause cellular. But like I said, I think there's really not that much that the doctors will kind of check to have, in general population that we, unless there's any type of suspicion that it's something. But to routinely check, like Dr. DeNicola said, it is not recommended.
There's something that really take more of or
So, okay, just repeat the question, on this mental here said, is there anything that a woman should take if she's trying to conceive or while she's pregnant, and I add while she's breastfeeding? So, I do recommend women that are trying to get pregnant, the easiest thing, at least try to take a prenatal vitamin. In the prenatal vitamin, folic acid will be in there. The reason why I mention that is a lot of times when women get pregnant, they don't realize they're pregnant right away. And the time for the development of the fetus happens early on. So during that first month, especially around week 5, that's when the development of the brain, neurodevelopment happens. And during that time, you just miss the pregnancy. You don't realize you are pregnant a lot of the time. And folic acid is very important for nerve to defect. So it's a prevention for that. So if you, and I mentioned this earlier, if you have a history in the past of nerve to defect, which is the spine, you cannot closing up completely that way, folic acid is one of the things that does happen. And that's in prenatal vitamin. So you can take folic acid as a specific prenatal vitamin. The other thing is, if you do bleed a lot, like prenatal vitamin iron in there, it can be very helpful. However, kidney iron sometimes can cause constipation. So I always kind of tell my patients that are kidney iron, you might get constipation. If you let me know, but that can increase your water intake, your fiber intake, which is mean vegetables. Okay, so those are things we usually take my patients. For breastfeeding moms, I should tell them to continue to feed vitamins. A lot of times when you have a new baby, you're not feeding as well. Okay, it's very cool. You're feeding, especially breastfeeding, you could be breastfeeding every 2 hours, lack of sleep, you're not doing so well. So continue the vitamins will help with that supplementation at that time. And those are the times where I say, yeah, continue, get no reason why. I understand when you're breastfeeding, your metabolism is picking up, because it's producing all that milk. So I take 5 times a day, so I recommend it for normal, which is even more than when you're pregnant. Which is only good. So my with breastfeeding, it's all about supply and demand. And yes, the baby will get custody at the beginning, but the baby knows how much she needs the diet. So we would suckle on the breast longer. And what happens is it will trigger the brain, and the liver like, okay, I need to produce more milk. And in my making sure that you are well hydrated. That's one thing. Because if you're not drinking enough water, you're not eating well, you're not going to produce milk. So making sure those things happen. And also making sure your immune system is good. So those are things I usually recommend for my patient. However, being a mother myself who has children, I thought that mother's milk, which has some Greek in it, was very helpful for me when I returned back to work. So I was pumping at work, this is during my residency, and my milk just decreased, half. And if anybody has ever breastfed or pumped before, it's liquid gold, really what it is, and it's not producing enough. But my thing was it because I took, the mother's milk type of baby, or because I was drinking, 6 cups of tea a day? Because I was hydrating myself and I was forcing myself to drink water. But sometimes when you're working, you don't think about that when I'm saying well hydrated, so I don't know. It's like I said, there's no deep studies out there that actually caught like a link between. However, I would do it myself just because I pretty much wanted to do something to help with my personal, because I wanted to breastfeed my children, and it wasn't helpful for me. So I would do case by case basis with my patients about that, and I understand that you just want to have something to help you produce more breast milk, especially now you know all the benefits of breast milk. Any other questions?
Okay. So thank you.
Thank you so much, everyone, for coming, and thank you for having me.